Seeing a part of us this Saturday early morning, warm and nice and hot to discuss a hot topic. It's been like head and neck is really a big focus in our country, something we know which can be avoided, but at the same time, we have the largest number of patients who are affected by oral cancer and head and neck cancers. So we have Dr. Arjun Singh from Tata Memorial Hospital and Dr. Nisha from Varanasi, and soon we'll be joined by Dr. Pankaj Chaturvedi, who had to go in for an emergency. But I'm very happy that Dr. Arjun Singh and Dr. Nisha both could join in at a very short notice because there were emergencies all over, but they really helped us by standing in for their colleagues and by answering our questions for the patients. So what I'll do is, Doctor, divide the session into different segments. Can we start with prevention? And may I request, first of all, may I request Dr. Arjun Singh to introduce himself and then take on the prevention part of it.
Hi, madam. Thank you so much. And good morning, or rather good afternoon to all our esteemed guests and audiences that are there listening to us today. I'm Dr. Arjun Singh. I work at Tata Memorial Hospital. And I have been at the hospital since about 6 years, 5 to 6 years now. And of course, we will be talking about prevention and, the rest of head and neck cancer. But there is one thing which I think I want to get very clear at the onset is that these are some of the most preventable cancers that are out there. These are some cancers, कभी-कभी क्या होता है कि अपने आप से कैंसर हो जाता है काफी लोगों को, पर इसमें ऐसा नहीं है. इसमें तंबाकू, अल्कोहल एंड एरिका नट सुपारी, इनके बहुत ऐसा महत्वपूर्ण रोल होते हैं इसमें. So I think it is very important to focus on these topics, and if something is, the age-old saying goes, prevention is better than cure. But I think this is something where we need to focus our attention on. So, madam, please, you can take it forward.
सर डॉक्टर सिंह, क्या होता है, हम लोग बहुत सारे अटेंशन फोकस कर रहे हैं इन चीज़ों पर कि आप तंबाकू मत खाइए, आप सिगरेट मत पीजिए और आप बीड़ी मत पीजिए, लेकिन हर एक का अलग अलग इसका वो है. जैसे जो टैक्सी चलाता है वो कहता है मैं इतना बोर हो जाता हूँ कि मुझे ये खाना पड़ता है. कोई कहता है कि हमारे पास पैसों की कमी है तो इसलिए हम ये सब चीज़ें खाने लगते हैं. कोई कहता है कि ये सारे रूल हम गरीबों के लिए ही बनाए. अगर प्लेन में आप ट्रैवल कर रहे हैं तो आप तंबाकू वगैरह खाते हैं, कोई कुछ मना नहीं करता है. लेकिन अगर हम ट्रेन में जा रहे हैं तो फिर लोगों को ऑब्जेक्शन होता है. लेकिन प्लेन में भी बार बार अनाउंस करते रहते हैं स्मोकिंग इज हार्मफुल, यू आर नॉट अलाउड टू स्मोक एंड ऑल दैट, बट नोबडी टॉक्स अबाउट ईटिंग द टोबैको. सो कुड यू टॉक अ लिटिल अबाउट दैट? उसके बारे में आप बताएंगे तो लोगों को पता चलेगा कि ये खाली अमीरों की बीमारी है या गरीबों की भी है या किसकी है या नहीं है.
पहली बात तो आई थिंक कोरोना वायरस ने हमें बता दिया है कि कोई भी बीमारी कोई सोशियो इकोनॉमिक क्लास से बनती नहीं है. तो दैट बीइंग सेड, कैंसर एंड स्पेशली ओरल कैंसर कैन हैपन टू एवरीवन. एंड जो आपने बताया है, मैं एक एक चीज को ऐसे एक्चुअली पॉइंट आउट कर सकता हूँ. आपने पहला बोला है कि ड्राइवर्स, स्पेशली वॉचमैन जो लेट आवर्स ऐसे काम करते हैं, जो दे नीड टू बी वेरी अटेंटिव एटलीस्ट. आई थिंक ये सबसे बड़ा मिसकंसेप्शन है, एंड दिस नीड्स टू बी क्लियर. ऑफ कोर्स डेफिनेटली टबैको डज कॉज अ लॉट ऑफ स्टिमुलेटिंग इफेक्ट्स इन योर बॉडी, और आप एक अच्छे इफेक्ट के लिए आप एटलीस्ट 1000 हजारों ऐसे बैड इफेक्ट्स आप पा भी रहे हो. So I think it is individual based, which they need to understand that आप एक अच्छी चीज के लिए इतनी बर्बादी आप सहन करना चाहते हो तो definitely please go ahead. Secondly, आपने बताया कि I think train or plane. I think tobacco warnings are everywhere now, and with the great efforts taken by all of public awareness and this dissemination of the right information, I think a lot of places, public places, have no spitting and no smoking. Smoking to Thai, it's become very common. But the pandemic has also helped us in the fight against no spitting. indirectly, definitely encouraging less tobacco, chewed tobacco use. Third thing you said कि अमीरों की बीमारी या गरीबों की, like I said, I don't think there is any distinction. And in fact, हम लोग देखते हैं कि एरिका नट, which is also सुपारी जो हम बोलते हैं, and alcohol, these are also some of the very, very important risk factors, which I think is also prevalent in higher socioeconomic groups. So definitely हम लोग मारवाड़ी कम्युनिटी में या नॉर्थ इंडिया में, आई थिंक, एंड साउथ इंडिया इनफैक्ट, एरिका नट जो सुपारी हम बोलते हैं, वेरी वेरी ऐसा प्रेवलेंट इन आवर डे टू डे. हम भगवान को चढ़ाते हैं सुपारी, हम किसी के घर जाते हैं तो तब सुपारी लेके जाते हैं. So it is more of a ritual and it is very ingrained in our culture. So I think I don't think
डॉक्टर सिंह, जब किसी को मारना होता है तो भी हम सुपारी देते हैं ना.
वो इंटरप्रिटेशन आपका है.
इस तरह से सुपारी मतलब इज अ किलर,
बिकॉज़ यस यस डेफिनेटली. तो चलो, it is in all aspects में it is very clear that these are harmful substances. And this is not because I am saying it or Jyoti madam is saying it or Vandana madam or anyone is saying it. These are substances which organizations such as WHO and UNAP, there are very very big organizations, इन्होंने काफी research किया है. And of course tobacco के पैकेट पे तो लिखा हुआ ही आता है, and शराब के बोतल पे भी लिखा हुआ आता है that is injurious to health. But now it is also coming because of regulatory constraints. We are fighting and trying to get it even on the tobacco pouches. So, and pan masala. So all of these things are इनके ना unregulated market है अभी फिलहाल. So we are trying our efforts, of course, along with WeCare and a lot of other organizations, and trying to create public awareness के अगर लिखा हुआ है या शाहरुख खान या अमिताभ बच्चन ये सब ऐड करते हैं, these are not things which we should follow on. These are our unhealthy heroes. So, the right people are needed for the right job, not the right people for the wrong job.
डॉक्टर निशा, एक बात पूछना चाहती हूँ. अभी डॉक्टर सिंह ने बताया कि बहुत एफर्ट हो रहे हैं वेरियस ऑर्गेनाइजेशंस के थ्रू, यहाँ पर टोबैको के लिए या तंबाकू के लिए या सुपारी के लिए मना किया जा रहा है. तो लेट्स से लास्ट 10 years में क्या डिफरेंस हुआ है? Has the number of heroin cases come down, or it's been the same, or the efforts have to be done in some other way?
The efforts, even in the last 10 years, first we used to not have these packets, the cigarette packets, the tobacco packets having information. We didn't have pictures of cancer patients on them. So we have a lot of with efforts from Dr. Pankaj. There's been a lot of various organizations. There's been a lot of efforts to bring awareness among the children and among people who cannot read, to just pictorial representations have been put up to make them aware. In a lot of municipal hospitals also, there are a lot of posters that are there which bring in awareness. But we need to understand that the awareness platform has changed now. We do not all go to the municipal hospitals, and not everyone who opens a packet of tobacco is seeing the picture, I would say. But there are other platforms that we have now, that we have Instagram, we have Facebook, we have other Netflix, so many other platforms that we can use to bring more awareness. So that has to be looked into. A lot of efforts have been made, but it has to be a continued effort. Prevention has to be at all levels, primary, secondary, as well as tertiary. तो जब हम देखते हैं कि पेशेंट्स बहुत लोगों को लगता है कि हमें तो बच्चों को भी कैंसर हो जाता है, तो बच्चों ने तो टबैको यूज नहीं किया, उनका कैंसर अलग है, इतना अवेयरनेस भी नहीं है उनमें. तो इट इज लाइक दे फील कि हम तो तंबाकू खा रहे हैं, हमें कैंसर हो गया. दिस इज समथिंग व्हिच आई पिक्ड अप व्हेन आई जॉइंड वाराणसी, कि हमें तो कैंसर हो गया, पर हमारे बच्चे ने तो नहीं खाया है, तो उनको क्यों ब्लड कैंसर हो गया. तो ये सारी जो चीजें है, उसका अवेयरनेस, कौन सा कैंसर किससे होता है और तुम्हें क्या ध्यान देना है, दैट इज मोर इम्पोर्टेंट. So it is not just that tobacco, say oral cancer, but they have to understand that you are doing something which is preventable. So this, a lot of awareness has to be still brought, and we have new platforms now. Like we have a lot of medical colleges coming up. Every medical college has at least 100 students. Every medical college, we all know, has a history of like the MBBS students also, they have history of smoking. So that level awareness, when they see doctors coming up and they are smoking. So all these things, it has to be at multiple levels. Netflix does not bring in any notice, no statutory warning that smoking is injurious to health when there's a scene. We have it in cinemas, but we don't have at all levels. And the way we are seeing Instagram, the way we there is no head and neck cancer awareness on Instagram. There is no page. There are so many pages. There are so many platforms. We don't have an head and neck awareness program in India as of now.
तो आपका कहने का मतलब है कि अभी तक जो भी हेड एंड नेक के लिए किया जा रहा है या ओवरी कैंसर के लिए किया जा रहा है वो उतना इफेक्टिव नहीं हुआ है जितना कि आप
No, it has been effective. I'm not denying that, but we need to change our platforms. That is what I am suggesting. We need to change our platforms. We are doing a lot. The government is doing, the institute is doing.
आपको एक चीज बताती हूँ, जो फिल्म आप लोग दिखाते हैं मूवीज में जिसमें उसको कैंसर हुआ है मुकेश को और वो हेड एंड नेक हुआ है और फिर उसकी डेथ हो जाती है, यू नो इट्स सच अ गॉरी मूवी, इट्स सच अ गॉरी एडवर्टाइजमेंट दैट आइदर पीपल डोंट you know watch it or they walk out. If it is after interval they go in late in the picture hall, or if it is before then they walk out before, you know, while the ad is being played. So maybe we have to learn how to make it meaningful instead of showing those.
So this I would like to put ahead in one way, because when I joined head and neck, how I describe it to my mother, that what I will be doing is, I told her this ad that you're seeing now, I'm going to be treating this cancer. So for them to see that ad itself is not acceptable, but we have to now understand that that is happening in cinema halls. We need to have such gory advertisements. It is essential, ma'am, because what we see in practice is more gory than what we see on screen.
आपका अभी सर्जरी करके आएंगे तो आपने देखा होगा क्या था वहाँ पर और क्या नहीं था. So I'm sure you see a lot of cases like that. So डॉक्टर सिंह एक चीज पूछनी थी कि हेड एंड नेक कैंसर और एचपीवी में कुछ रिलेशनशिप है क्या, एचपी वायरस में और हेड एंड नेक कैंसर में? Have you seen anything?
So viruses and head and neck cancer में relation है, but it is not true for all head and neck cancers. अभी head and neck में काफी ऐसे सब parts होते हैं, जैसे oral cavity, oropharynx, and जो हमारा voice box होता है, तो ये and lower down, तो ये सारे cancers में definitely oropharynx cancer has the highest association with HPV. So that being said, hello.
Yeah, we can hear you, Arjun.
Sir. Morning, sir.
Yeah, Vandana, your frame is frozen.
Yeah, Dr. Singh, you continue. I think it's an issue there.
Yeah.
So definitely HPV cancer के काफी ऐसे association होते हैं with, that is one of the cancer. Another type of cancer which is related to virus is the nasopharyngeal, जो नाक के पीछे वाले cancer होते हैं. That also has a high predilection for Epstein-Barr virus, EBV virus, and this is seen more in the eastern part of India. And इनके भी जैसे prognosis जो outcome होते हैं, they are at least HPV related cancers उनके अच्छे होते हैं. So it is very important to identify कि कौन से type के cancer has association with which type of ऐसा etiology जो positive factor है.
Yeah, go ahead, Arjun. Vandana ma'am, your screen is again frozen.
I think there's some network issue at the end. Yeah.
Okay. So I'll just add something to what Nisha and Arjun have very nicely and elegantly said. One is certainly about tobacco and alcohol. We know that tobacco is very harmful and everyone knows about it. And what Nisha was saying is right, that when we show these movies in the cinema hall, the aim is to not only educate the user, but the family, because people go to see movie with their family, and let the family also know that what tobacco causes. And that's an additional pressure that is there on an individual, an additional motivation. See, what we have seen normally, that children are the biggest motivators for an user to quit tobacco. And when the children see the harmful effects of tobacco, they create a positive atmosphere and maybe a pressure on the parents or the father to quit smoking, and it works. And the very reason they walk out is something that we want. We want not awareness, we want awakening, because I'm sure there are various ways of creating awareness, but it doesn't work in case of tobacco, because it is so addictive that the level of awareness has to be like an awakening where a person is jolted into leaving it. And graphic images work on that. Therefore, we had pictures of scorpion and chest x-ray and those things on cigarette packets. It never worked. But the last global adult tobacco survey does show that these gory pictures that have been contributed by Tata Memorial Hospital, it really works, and people are prompted to quit tobacco because of this. What is something additional which is happening recently in our population is teenage drinking. And this teenage drinking has become rampant, especially in the metros and even in the mid-tier cities. And the reason is that the children, the youth, the adolescent do not know how to socialize. For them, the only way to socialize is to have drinks. And those who do not drink, they are looked down upon as, less civilized people. So there is a peer pressure which leads to promotion of alcohol. Now, we have discussed about cinema's influence. If you look at the current cinemas, almost there is an average of at least 60 to 80 scenes of alcohol. In some of the most, I would say, high profit making cinemas. Now, the celebrities might say that this is the artistic expression, this is the freedom of creativity, this is the freedom of expression, this is the editorial choice, this is the director's discretion. All these are fine, but they know that the same Shah Rukh Khan, when he promotes Vimal Ilaichi, the sale of pan masala goes up. When he has a drinking scene on the cinema, it creates a positive impression on the youth to pick up alcohol. So the celebrities should understand that it may be a director's discretion to add a smoking scene or alcohol scene, but the impact it has on the followers and the fans is immense, knowing very well that these are harmful substances. The second and rather third, tobacco, alcohol, areca nut we have talked about, and recently the health ambassador of Ministry of Health, the Fit India champion of Ministry of Health's campaign, Akshay Kumar, was endorsing Vimal Pan Masala. Now, these people are not uneducated. They are not illiterate. They know why a Ilaichi maker is giving them 20 crore or 40 crore. They should have the basic knowledge that for selling Ilaichi, nobody is going to give them so much of money. It is for surrogate advertisement. And if someone has taken 20 crore, you can imagine the profit will be at least 2,000 crore. Then only somebody will give 20 crore. Now 2,000 crore worth pan masala, if it is sold in this country, you can imagine what Nisha and Arjun has to do in OR. We don't want to operate patients. We don't want cancer patients. And the only way is that we should step up on prevention, healthy lifestyle, what Vandana and her team are doing. And the last and not the least and very important is the rise of weed consumption. Today, a lot of people say tobacco, harmful. Alcohol, yes, it is socially acceptable, but less harmful. Weed, people feel that it is safe and it is a way to, again, have fun. And weed has become very common. I never knew till my daughter went to the college, and I came to know that weed is much more common than tobacco and alcohol, and it is freely available. And we know that weed itself, the marijuana or the ganja or whatever we call it, this is very, very harmful. It causes mental health issues. It causes neurocognitive problems. It causes cancer, and other social issues and ramifications are, more important. So, Vandana, what is important that our youth are being pushed into these habits by nefarious industry purely for profit.
So Dr. Chaturvedi, I know you have to go early, so I'm going to ask all my questions from you before you go. One is about children. Do you think the education should start while they are still in school so that they become educated about not using these harmful products? And how effective can it be made for them to know? Second is why certain areas in the country are more prone to head and neck cancers, like the East and the Northeast and UP and maybe Maharashtra, maybe not Maharashtra. So these areas are more prone for some reason. And also that, when you have head and neck cancer, then the problems come in, जो कि सब लोग कहते हैं अरे इसको तो किसी तरह की मदद देने की जरूरत नहीं है क्योंकि ये तो अपने आप अपना तंबाकू खा खा के ये सब प्रॉब्लम करिए, तो उनको कैसे हैंडल करें और उनके घरों में क्या प्रॉब्लम आती है उसकी वजह से वो क्या करें? बहुत सारे क्वेश्चन पूछ रहे हैं, अब आपको बता के ही जाना होगा.
Yes, I will do that. So I'll take the last question first. For me, a smoker or a smoking related cancer patient is a victim of a carefully planned marketing campaign by an industry which sells cancer for profits. If there was no tobacco industry, there was no seller, there was no kiosk, and perhaps we will have fewer head and neck cancer patients. So for me, when someone says that, किसी को cancer हो गया है and it is because of his ill habit and he doesn't require any sympathy or support, it is wrong. He is suffering from a disease, and that disease is sold to him by a profit-making industry which has been promoted by some of the political parties and the government. So for us, it is important to understand that. Second, tobacco addiction is classified as a disease. Please do not consider tobacco as a habit. Under the ICD classification, ICD-10, comes under the category of a mental problem and a mental health issue, and therefore he requires as much sympathy as any victim of any disease. And trust me, the most fatal thing about tobacco is 1/3 of the tobacco user dies prematurely. What Nisha was saying, that people say, हमारे अब्बा 80 साल तक तंबाकू खाते थे, उन्हें कुछ नहीं हुआ. हमारा friend जो है smoke करता है, he is healthy. All those things are wrong. That is a pure denial. We know that people who use tobacco, they die at least 6 to 8 years earlier from very fatal diseases. And those fatal diseases are such that before they die, they exhaust all the deposits and bank balance and leave behind poorer families and poorer children. So a wrong choice made by an individual will have an impact on the entire family who never smoked, who never used tobacco. So tobacco victims and tobacco users require all sympathy from the doctors, and we should work towards eradicating the industry, not ostracizing the victims. Now, next question that you asked, that how do we address children? See, most important thing is that we have to inculcate good values in our children at home. What happens that today parents do all kinds of, wrong habits, say they themselves smoke or drink alcohol or, unhealthy lifestyle of not exercising or not having healthy food. Now, obesity is as much bigger problem as is tobacco and alcohol. So all this has to start from home. And if it starts from the home, trust me, the very reason why I never smoked or took alcohol, because I made a promise to my mother. It was not my teacher. It was not the education. It was never a awareness that let me do this. It is just that in our family, it was not permitted. And therefore, I just continue to follow the habit, be it a non-vegetarian diet or whatever. Now, non-vegetarian diet, I'm not promoting here. What I'm saying, tobacco, alcohol, the value should come from the family. Now, coming to what we can do for the peer pressure, it is very simple. We have to stop the advertising and celebrity endorsement. And very important, tobacco-free education institution. There is a law which says that inside the school and 100 yards of the perimeter of the school, tobacco should not be sold, it not be used. So these are the simple policy measures which, in addition to awareness and other things, will certainly reduce the consumption in younger population. And once it reduces the younger population, see, please understand, if tobacco eradication or tobacco cessation was so simple, tobacco would have been a history by now. The very reason we have been discussing the same webinar, same conferences, same discussion is because it is highly addictive. It is difficult to quit. The best is to stop initiation, not just work on cessation.
So, Dr. Chaturvedi, I can understand कि आप लोग बहुत मेहनत कर रहे हैं टोबैको को हटाने के लिए, लेकिन कहीं ना कहीं से या तो कोई सेलिब्रिटी आ जाता है. मैंने अभी थोड़े दिन पहले देखा था आपका लिंक्डइन पे, तीनों शाहरुख खान और ये अजय देवगन और ये लोग सब खड़े हुए थे और प्रमोट कर रहे थे. तो नेचुरली वो कुछ कहीं ना कहीं तो उसका गलत असर पड़ता ही है, और पेरेंट्स का भी. लेकिन आपकी ये जो बात है कि इंस्टीट्यूट में अलाउड नहीं है, वी सी दैट पेशेंट के साथ में जो केयर गिवर आते हैं वो अगर उनकी रेगुलर चेकिंग करें और अगर वो टोबैको भी हम पाउचेस जमा करें तो शायद 2 दिन में एक बड़ी बॉटल उस पाउच से भर जाएगी. वो अभी भी ये चीज को लेकर आते हैं और मतलब सिक्योरिटी भी कितना कर सकती है. तो हम क्या करें जिससे कि केयर गिवर कम से कम अवेयर हो जाए, जिससे कि उन्हें पता चल जाए कि अगर वो कहते हैं हाँ इसको हुआ है हमें तो नहीं हुआ है, लेकिन उन्हें ये बताना है कि उसको आज हुआ है कल आपको भी हो सकता है. ऐसा कहना खराब लगता है, लेकिन कोई और इफेक्टिव तरीका है जिससे कि उनको बंद कर सकते हैं ये काम.
सो एक बहुत फेमस सेइंग है, कैंसर क्योर्स स्मोकिंग. ये बहुत पुराना एक है. जब कैंसर हो जाता है ना तो स्मोकिंग अपने आप बंद हो जाती है. तो कोई भी नहीं चाहेगा कि कैंसर करके ही स्मोकिंग बंद करें. बट वी डिड अ स्टडी एंड वी पब्लिश्ड इट आल्सो, एंड वी फाउंड that the happening of cancer in patient has a positive impact on the relatives if they are counseled properly by the doctors. So you are absolutely right. Every doctor, we are doing it in TMH, but we should do it elsewhere in the country also. That doctor should spend 2 minutes extra with the relatives of the patient who are current smokers or current tobacco users and promote them to quit the habit, because they are seeing the most graphic outcome of tobacco use in their own eyes, in front of their own eyes.
So, Dr. Nisha, आप अभी नई आई हैं, फिर भी आपने आई एम श्योर बहुत केसेस ऐसे देखे होंगे जो आपके मन में गहरा असर कर जाते. कोई एक केस आप बताना चाहेंगे ऐसा?
So ma'am, there are a lot of cases. ऐसे में सिर्फ एक आपको जैसे बता रहे अवेयरनेस स्प्रेड करने के लिए, there are a lot of times when we get patients who are like between the age of 30 to 40, but उनका हम ऑपरेशन नहीं कर पाते. उनका डिजीज जिस स्टेट में आता है वो इनऑपरेबल स्टेट में आते हैं या बहुत ही एक्सटेंसिव डिजीज में आते हैं. तो एक्सटेंसिव डिजीज में तो हम ऑपरेशन कर भी देते हैं, बट ऐसे पेशेंट्स को जिसमें इतना बड़ा कैंसर हो जिसमें तुम ऑपरेट नहीं कर पा रहे हो, ऐसे पेशेंट को बोलना कि ठीक है, यू हैव फेस, तुम्हारे से हो गया है, तुमने ये सिचुएशन फेस किया है, यू टेक अ रिस्पॉन्सिबिलिटी कि तुम 50 आसपास के लोगों को जो तुमसे मिलने आए उनको, मैं ऐसे बोलती हूँ कि तुम अपने 50 एटलीस्ट लोगों को बोलो कि मेरा ये कैंसर तंबाकू के वजह से हुआ है, तंबाकू नहीं खाना चाहिए. उनके मुंह से अगर एक बार निकले टू पीपल हु आर कंज्यूमिंग टबैको, it makes a difference because they are suffering and they think it is their duty and they do it. and they accept that they will do it. So at least we can just say it once, because you just tell them कि ये तो तुम्हारा तंबाकू खाने से हुआ है, ये कर, because they are in such a a soft situation when they are diagnosed with cancer. They know there is cancer breeding in their mouth, but they are scared to come to us. हमारे पास आने से डरते हैं, and they know that cancer is a dreadful thing. तो वो जब बताएंगे ये दूसरे अपने relatives को, that will make some impact at least to the relatives.
So Dr. Singh, two questions from you. One is कि एक बार किसी को लत लग जाती है टोबैको की, तो कितनी आसान है उसको छोड़ना, छोड़ पाते हैं या नहीं, या हमेशा के लिए हो जाता है? और दूसरी बात ये कि जैसे जब आप लोग सर्जरी करते हैं तो अक्सर पेशेंट को लिक्विड डाइट पे रहना पड़ता है, तो क्या वो जिंदगी भर के लिए लिक्विड डाइट हो जाती है या कुछ समय बाद वो खत्म हो जाती है, मतलब नॉर्मल खाना खा सकते हैं?
So I'll take the second question actually is हम लोग क्या करते हैं बेसिकली द लिक्विड डाइट, एंड हम लोग एक ट्यूब डालते हैं नाक से पेट में जाते हुए, तो इससे हम लोग खाना देते हैं. तो ये चीज़ बेसिकली वी डू सो दैट मोस्ट ऑफ द कैंसर जो ओरल कैंसर होते हैं खाना हम लोग मुंह से ही लेते हैं. तो आई थिंक वी वांट टू अवॉइड द चांसेस ऑफ एनी इन्फेक्शन और एनी वुंड डैमेज और ब्रेकडाउन, एंड दैट्स व्हाई हम लोग एक बाईपास ऐसे फीडिंग ट्यूब करते हैं. अभी there are some methods of rehabilitation जो हम लोग speech and swallowing में assistance देते हैं, काफ़ी techniques होते हैं जिससे patients do learn, and eventually you can go back to whatever you were eating and drinking. But sometimes in some types of cancer, yes, there is a small proportion, especially जो voice box के cancer होते हैं, laryngeal cancer and hypopharyngeal cancer, उसमें देयर इज अ चांस के जो खाना या ऐसे लिक्विड्स हम लोग लेते हैं द पेशेंट कैन एस्पिरेट, मतलब वो छाती लंग्स में चले जाते हैं, तो इससे लंग के इन्फेक्शन एंड चांसेस ऑफ निमोनिया काफी बढ़ जाते हैं. सो डेफिनेटली सम मोस्ट cancers patients can go back to their regular lifestyle of eating and drinking. But definitely there are a few which you cannot.
डॉक्टर चतुर्वेदी, 2 मिनट खाली ये पूछना था. मेरे को मालूम है आपकी फ्लाइट है और आपको जाना है, लेकिन 2 मिनट का एक क्वेश्चन ये पूछना था कि कैंसर पेशेंट की जर्नी में जबकि उनको कैंसर हो गया, उनको तकलीफ हो गई, आपने उनकी सर्जरी कर दी या ट्रीटमेंट कर दिया या क्या, किस तरह का सहयोग घर वाले या चैरिटेबल ऑर्गेनाइजेशन कर सकती है जिससे कि उनकी जिंदगी जल्दी से जल्दी वापस नॉर्मलिटी पे आ जाए?
तो उसके 4 कंपोनेंट्स हैं: मेडिकल, फाइनेंशियल, फिजिकल, मेंटल. नाउ फाइनेंशियल, व्हाट वी हैव सीन दैट हेड एंड नेक जो है गरीब लोगों को ज्यादा होता है, एंड दोज पीपल हु मे नॉट हैव रिसोर्सेज फॉर देयर ट्रीटमेंट. सो TMH में आप जैसी संस्थाओं के चलते हमें बड़ा सुकून रहता है that we are able to offer treatment to those poor people also, and that has been a big boon because कभी भी हम गरीबी के चलते और deprivation के चलते we have never deprived anyone of cancer treatment, whether it is chemotherapy, radiotherapy, or surgery. And I must thank WeCare and many NGOs who have helped in this situation. Now, the bigger problem is in the financial, that people who even have insurance, when they go for claim, their claims are rejected because once there is a habit of tobacco use, which we cannot hide, none of the tobacco users ever get their insurance benefit, which is a crime in my mind, because they have been offered insurance, and the insurance agent, in their enthusiasm to recruit more people, they don't even discuss this with them and people ignore it. But at the time of claim, it becomes an issue. So this is one issue. And we should know that in India, many families are pushed into poverty only because of cancer. Now, second is the mental health problem, because it causes depression and anxiety and many things. And there again, doctors play a very, very important role in taking care of the issues that are related to mental health and involve a psycho-oncologist or a psychiatrist, or even consoling the whole family together, because cancer doesn't happen to the individual alone, it happens to the entire family, and the whole family requires sometimes counseling and support. So mental health is a very, very important problem. Medical problems, certainly doctors can deal with it, and what is more important is multidisciplinary approach. See, what happens in Tata Hospital, a patient requires all three: surgery, chemotherapy, radiotherapy. That is taken care. But what is more important is speech and swallowing rehabilitation, physiotherapy, and then counseling for mental problem. So basically, we have to involve specialists, because there are multiple dimensions of cancer treatment, recovery, rehabilitation. And most important is physical. Now, physical, we have to understand that a person may have a certain kind of job, and once he gets cancer, then in that situation, because of his disability to speak, or certain speech problems, or swallowing problem, or disfigurement, or disability to walk, there has to be some kind of support for them in the workplace and by their employers, that how do we support to rehabilitate and make sure that they continue to work they are. Similarly, many cancer patients, they do not ever get the insurance policy itself, because these days we have young thyroid cancer patients who survive for 40 years, 50 years. But these pediatric cancer patients live for another full life, and they are deprived of any kind of insurance. So they are always having this kind of issue that they live on their own for any treatment which may not be related to cancer in their future life. So all this is a very complex issue, and there is a need of understanding each and every ramification that emerges out of all these, and we should address that.
तो डॉक्टर चतुर्वेदी, आजकल जो नई दवाइयाँ चल गई है, इम्यूनोथेरेपी वगैरह हो गई है, अलग अलग मॉलिक्यूल्स आ रहे हैं, ये सब हेड एंड नेक के लिए भी है, या इसमें अभी तक वही स्टैंडर्ड कीमोथेरेपी, रेडिएशन, सर्जरी ही चल रही है?
See, we must understand that the medicine has evolved very fast. Surgery has refined further. And there are multiple options currently available to the cancer patients, even in the palliative care, palliative setting. What is more important is adherence to the evidence-based guidelines, and also adherence to taking a second opinion. The reason is very simple. Sometimes you take an opinion and the drug is costing some 15-20 lakhs. Now, one thing is that when we are in that situation, we are very vulnerable. But when we take second opinion from a good organization and a reputed organization, sometimes you can avoid unnecessary medication. But what is more important is adherence for the doctors to evidence-based guidelines. And many of these expensive newer treatment, the margin of benefit is very, very small, where the cost is very high. And there, when I say small, the addition of life can be just few months, but the deprivation can be for several years, because when you exhaust all your resources, your children, your family suffers for several decades sometimes. Therefore, there has to be a value judgment in instituting or engaging these newer molecules.
बहुत कॉम्प्लिकेटेड स्टोरीज हैं ये सारी, पर मुझे मालूम है कि कई सारे, मतलब अभी हाल की बात है कि कोई पेशेंट आए थे जिनके साथ में कोई भी नहीं था हॉस्पिटल आने के लिए, क्योंकि सब लोग दिहाड़ी पे काम करते थे, डे वेजेस पे, एंड सो दे डिडंट वांट टू गिव अप देयर वर्क, and the patient is unable to pay for help every day. It's going to be a big challenge. और जितनी भी संस्थाएं हम लोग काम करती है, वहां पर थोड़ी देर के लिए कुछ काम करना है तो कर सकते हैं, लेकिन घर से उनको लेकर आना, इलाज करवा के वापस घर छोड़ना, that becomes a challenge for us. Yeah. So maybe we should think of something on those grounds. क्योंकि अगर कोई जना मतलब समर्थ है, और अगर समर्थ फिजिकली फिट है और वो अपने आप ट्रैवल कर सकते हैं, तो उनको आने के लिए या उनका ट्रीटमेंट हमें नहीं रोकना चाहिए, या फिर उनके लिए कुछ स्पेशल वो करके अरेंजमेंट उनका वहीं पास में करवा दें, ताकि वो पास में रह के अपना इलाज करवा सके, क्योंकि इस तरह की चैलेंजेस कोई भी जना करना जरा मुश्किल हो जाते हैं, पर आते हैं। आई एम श्योर आप लोग ने अपनी प्रैक्टिस में बहुत कुछ देखा होगा। डॉक्टर सिंह, ऐसा कभी हुआ है कि आपने कोई केस देखा हो जिसमें आप इलाज नहीं कर पा रहे हो. अच्छा, बिफोर you answer, Dr. Chaturvedi, thank you for being with us.
Thank you.
And thanks a lot for all the guidance. And also wanted to share with you that though we are working primarily with all the cancers, but we want to take up issues related to head and neck cancer in a more focused way, so that at least one area of cancer we can look after. So if there's
Yes.
anything that you would like to guide us, please feel free to do that.
So निशा और अर्जुन दोनों भारत देश का भविष्य हैं, and head and neck oncology का भविष्य है. They are much better than me, and they are the future. So I'm sure head and neck cancer patient का जो आपका mission है, they will accomplish. They will help you in every aspect.
Thank you very much. So Dr. Singh,
Thank you, sir.
question please. I guess you might have faced a challenge where you feel frustrated कि मतलब आप इलाज कर सकते थे लेकिन इलाज नहीं कर पाए, या परिवार वाले सहयोग नहीं दे रहे, तो आप इरिटेट हो रहे या फ्रस्ट्रेट हो रहे, या ऐसी कोई चैलेंजिंग सिचुएशन आपकी अगर आई हो तो?
Definitely आई है, and these sort of things stay with you. But I just want to say, sadly, just a statistic, we see about 60 to 70% हमारा OPD advanced stage cancer में आता है. So we do see a lot of inoperable या फिर untreatable diseases. So this is a very, very serious problem, because the livelihood of so many people, and as Dr. Nisha and Dr. Pankaj have highlighted, okay, these are cancers which affect the entire family and not just an individual. So जब भी हम counseling and frustration, or it is very frustrating actually to deal with these sort of patients, because उन्हें लगता है कि हम उनके पैसे के वजह से, या they are not affording, या there are so many barriers which come across, trying to communicate untreatable situation or other palliative situation.
Yeah.
Start by blaming the patient, and तंबाकू खाने से हुआ है, या that they are very vulnerable at that point. So I think it is very important to counsel them and make them understand that fine, you have come late for the treatment, but there are other second line therapies or other treatments that we have. At the same time, it's very important as a physician not to give false hope. Okay, don't worry, beta, सब ठीक हो जाएगा. आप इनके पास चले. You do need to be realistic.
So, Dr. Nisha, would you like to tell us once again about the early symptoms, early warning signs? Because आप लोग
Yes,
लेट आते हैं पेशेंट्स, तो इसके अगर early warning signs बता दीजिए.
So what happens जब भी हमारे पास early cancer के patients आते हैं, वो operation से और additional radiation plus or minus से वो curable है. तो हम हमेशा जो early patients आते हैं उनको encourage करते हैं. We try to put them on our OT list earlier. We have a separate OT list जो early cancer के लिए रहते हैं. तो कोई भी मुंह में छाला हो या कोई भी मैं head and neck की बात करूंगी, गर्दन में कोई भी गठान महसूस हो, तो इसका वो जो नॉर्मल नहीं है, इस चीज को डॉक्टर से दिखाना चाहिए. कोई भी मुंह में छाला जो 1 महीने से नहीं भर रहा हो, वो वाला छाला दिखाने आना चाहिए. दूसरा जो चीज है जो अर्ली कैंसर्स का है, जब हमारे पास पेशेंट्स आते हैं तो हम उनको बोलते हैं कि आप जल्दी आए हो, आपने ऐसे आके यू benefited you, and you should encourage others who have early stage lesions to come to us and get yourself treated. तो ये दूसरी चीज होती है प्राइमरी डिटेक्शन में, जब पहली बार कैंसर डिटेक्ट हुआ है. उसके बाद जब वो कैंसर ट्रीट हो जाता है, फॉलो अप में भी यही सेम चीज करती है. जब एक बार कैंसर हुआ है, वो पेशेंट को फिर से कैंसर ओरल कैविटी में या अपर एरोडाइटिस ट्रैक में आ सकता है. तो ऐसे में पेशेंट्स को बताया जाता है कि फॉलोअप में आना है, और फॉलोअप के लिए 1 मंथ 2 मंथ का जैसे फॉलोअप है. उसके अलावा भी अगर कोई और छाला उनके मुंह में उनको महसूस होता है या दिखाई देता है, तो जल्दी आने को एडवाइस किया जाता है. तो इट्स नॉट जस्ट कि तुम एक बार कैंसर डिटेक्ट हुआ तो तुम्हें नहीं हो सकता है, दोनों टाइम पे ये अर्ली डिटेक्शन का इम्पोर्टेंस है। नेक में कोई गांठ हो या मुंह में कोई छाला हो, थायराइड में अगर होगा तो इस तरफ बीच में गांठ आएगी, तो ये सारी चीजें इट शुड मेड अवेयर. Ma'am, I would like to just add a few things on the school awareness thing we were talking, if I could, with your permission.
Yeah, please.
Okay, for the school awareness, ma'am, जो 8th 9th standard के बच्चे रहते हैं, जिसमें उन लोग को that's when they start consuming alcohol, and these are the teenagers when they are little rebellious, और वो smoking में और peer pressure में आके ये सब करते हैं. तो ऐसे सिचुएशन में मैम, जब हम स्कूल में सोचे कि हम जाएंगे एक ग्रुप ऑफ पीपल, डॉक्टर्स, एनजीओ से सब मिलकर, वी विल हैव अ ग्रुप सेशन एंड वी विल मेक चिल्ड्रन अवेयर ऑफ दिस. मैम, बेटर देन दैट आई वुड सजेस्ट दैट आप जो क्लास टीचर्स होती है उनको अवेयरनेस के बारे में, मतलब उनको कैंसर के बारे में बता के, प्रिवेंशन के बारे में बता के, there's always one teacher who is very favorite among them, तो बच्चे उनका receptiveness उनके लिए ज्यादा रहता है. If we go as a NGO or a doctor to say that cancer इस चीज से होता है, ये नहीं लेना चाहिए, उन लोग उसको इतना नहीं ध्यान देंगे जितना if the class में in a particular session the teacher talks to them at a personal level, class level. That should be the aim for schools and colleges. This is what I would suggest.
I think it's a very good idea that pick up the favorite teacher और उनको encourage करें कि वो अपने students को इस habit पे ना पड़ने दें या उससे benefit या नुकसान बता दें, ताकि I know we had gone for a school talk and the children who attended the talk that day with us insisted that we have another talk the next day with their parents. They said that most of our parents are chewing tobacco and most of them have all these habits of BD smoking and all that, but we are not able to tell them. But once you speak to them, then maybe we can talk to them more freely about it. So the children know about it. Sometimes they know, and sometimes they are unable to express it to their parents, and that creates a lot of problems.
So, and having some kind of a pamphlet or a bulletin kind of a thing in schools and colleges for them to read. Like there are a lot of introverts who would not like to express or ask things, and they would like to just read. So मैं सब कुछ चीजें information इंटरनेट पे अवेलेबल रहती है, पर जब तुम्हें हाथ में मिलती है वो तुम ज्यादा अच्छे से पढ़ते हो. So if we could have some small pamphlet or a bulletin in each school, college, wherever these talks have been done, that even afterwards they can go through it and they can register better, because once we hear, we register once. Once we read and see, we register more, and we will always be more aware that way. So it's not because, like sir said, it is not smoking, tobacco, and all these habits are not habits; they are mental illness. So they, whenever they are low, whenever they have, they think they need the peer pressure to become strong. That's when they get into these habits now.
Yeah. But the thing है कि पूछना चाहती थी कि जैसे आप लोग सर्जरी करते हैं, आप मतलब कई बार डिसफिगरमेंट हो जाता है फेस का, और कई बार जो लोग जॉब कर रहे हैं उनको जॉब पे जाने में प्रॉब्लम होती है. ठीक है, हमने वॉइस प्रोसेसेस दे दिया, हमने उनको सिखा दिया कैसे बोलना है, क्या करना है, लेकिन कई बार फिर भी लोग बाग उन्हें ऑफिस में एक्सेप्ट नहीं करते और उन्हें जॉब में मतलब वही पोजीशन तो रेयरली मिलती है जिसपे वो थे, अनलेस यू आर मिस्टर शरद पवार, देयर इज अ डिफरेंट स्टोरी. पर उसके लिए आप कोई लेटर देते हैं, कोई चीज बताते हैं, या वर्क प्लेस में कोई तरह का मतलब इंफॉर्मेशन भेजते हैं ताकि उनकी एक्सेप्टेंस इजी हो जाए, ऐसा कर सकते हैं?
यस, डेफिनेटली हम लोग टाटा हॉस्पिटल से तो डेफिनेटली हम लोग फिटनेस सर्टिफिकेट देते हैं, बिकॉज सी दीज सॉर्ट ऑफ कैंसर्स आर डेफिनेटली डेबिलिटेटिंग. मतलब खाने पीने के इश्यूज होते हैं, एंड अ लॉट ऑफ physical issues can also be there, but at the end of the day they can definitely do something which is a seated job, and we define it as light work, so fit to do light work. Of course वो वापस अगर मजदूर था तो I don't think it is advisable for them to do any heavy work again, but definitely कई प्रकार के jobs हैं cancer patients के लिए as well. In fact, there is a few hospitals and in West Bengal which are actually only employing cancer patients for their supportive staff as well. So definitely, I think it is a double-edged situation where the employer as well as the cancer survivor both need to take active interest in rehabilitating this group of society.
और ये भी है ना कि जैसे उनके स्पाउसेस हैं, मतलब चाहे वो मेल हो चाहे फीमेल हो, उनको अपने स्पाउस के साथ फिजिकल इंटीमेसी वगैरह में भी प्रॉब्लम आ जाती है, तो आप लोग उसके लिए काउंसलिंग करते हैं या यू लीव इट टू द एनजीओ टू डू द काउंसलिंग ऑन इट?
So we do counsel, but it's not an active counseling. So if someone definitely asks these sort of issues, then we do go ahead and explain it. But I think the barrier is still there from as far as a doctor and a patient is concerned to ask these and answer these questions. I think ऐसे चीज के लिए, as Dr. Nisha has suggested, pamphlets and the unsaid things need to be sort of presented in a very different way. And I think आपके जैसे NGOs might also be finding it hard to have these discussions. So
Yeah.
I think
For us to talk about this is an easy thing because we can see the hesitancy and we know that they don't want to ask, but we don't ask them questions. We just start the conversation saying कि मतलब आपस में आप साथ में रहते हैं तो ये सब हो सकता है, ये है वो है. So we don't wait for them to ask. It's like a natural conversation that we want to pick up and have with them, so that if they are free to ask after that, then they feel happy to ask. Because हम लोगों के समाज में थोड़ा हेजिटेंसी है सेक्स के बारे में, फिजिकल इंटीमेसी के बारे में बात करने में. तो अगर हम अपने कॉन्वर्सेशन में नेचुरल ले आए, so then we are happy to answer those, ask more questions related to that. So
when physical intimacy is concerned, in head and neck cancer especially, because of the deformation, then plus the oral hygiene, because after radiation, because of the saliva being less produced, there's a lot of bad odor, bad breath, like that. So that is something which we must explain to them, that we can bring in some betterment, we can deal with things which can be changed. So all these things also play a part in what physical intimacy and the complaints that normally the wives have, they share secretly, but they do share if encouraged. And we must pay attention to these small factors also, especially in head and neck cancer.
Yeah. अब ये थायराइड है, थायराइड कैंसर, जो कि हेड एंड नेक कैंसर के एरिया में ही आ जाता है, पर उसके बारे में बहुत कम मालूम है. थोड़ा बहुत आई नो वी आर रनिंग आउट ऑफ टाइम, पर अगर आप 5-7 मिनट में कुछ भी थायराइड कैंसर में बता सकते हैं, क्योंकि ये भी सब जानते हैं कि थायराइड कैंसर टोबैको की वजह से नहीं होता है, तो क्यों होता है, कैसे पता चले, क्या करना चाहिए उसके लिए.
So thyroid cancer is basically the best cancer of head and neck that any patient can get. If someone says मुझे head and neck cancer होना है, एक हो जाए, तो best cancer that one should be able to choose is thyroid cancer. This is how I would put it, because thyroid cancer is 100% curable. You have years and years to live. Even after you have been treated completely for thyroid cancer, you will live like a normal human being, and you will have the chance of recurrence. And if at all recurrence occurs also, the severity of recurrence is not as the other squamous cell carcinoma of the head and neck. So even the head and neck, this thyroid cancer, इसके अलावा भी थोड़े और salivary gland cancers भी होते हैं जिनका long survival रहता है. और ऐसे cancers का awareness होना भी important है, because ऐसे नहीं कि thyroid cancer है तो somebody, people can just, being detected with cancer, can get suicidal. So these awareness also should be made. And thyroid cancer का patient हमारे पास आता है अगर होते हुए, we give them full information about how it can be treated. A surgery, which is not a major surgery, can be done, which is total thyroidectomy, hemithyroidectomy, depending on the size of the tumor. May or may not require a extended neck dissection. उसके बाद में रेडियोएक्टिव आयोडीन करके एक दवाई दी जाती है, वो भी हमेशा जरूरत नहीं पड़ती है, depending on the report, we will decide whether there will be any radioactive iodine given or no, which has minimal side effects. And it can, I'm emphasizing again that the survival is almost like a normal non-cancer human being. So you must be aware of that also. That awareness should be there.
What's the thing you want to add on something?
Yeah, just to add on, Dr. Nisha has highlighted most of the things, but I don't know if people are aware or not. But thyroid cancer is one where it is most common amongst women and of a very young age. I mean, young as in between the 20s and 40s. So I think this age is quite sensitive for your development, and काफी चीजें हो जाती है between 20 and 40, marriage, children. So I think a lot of apprehension comes in at this time, when you do get diagnosed with thyroid cancer. That being said, I think like Dr. Nisha has highlighted, this is one of the best cancers that you can get because it is 100% curable. It's a small surgery, and the scar on the that it leaves behind is also pretty small. But I think counseling is very very important for these patients क्योंकि उन्हें पता चलना चाहिए कि ये ऐसे टाइप के कैंसर होते भी हैं जो 100% curable होते हैं, and thyroid is one of them. So definitely go in for the treatment so that you can definitely extend your life, and quality of life also should improve because staying with cancer is not very easy, even though it is sometimes a slow growing cancer.
So जब इनके follow-up के लिए बुलाते हैं thyroid cancer के लिए, तो what is the interval when they are called for thyroid, and what are the type of tests that are done for checking whether everything is in control or not?
So thyroid cancer can be detected very commonly. Thyroid, they have certain nodules in the gland. दो thyroid gland होते हैं और उनमें अगर कुछ गांठ या ऐसे कुछ होए तो the most common presentation is कोई आके बोलता है कि swelling हो गया है in the thyroid region, और कभी गर्दन में भी साइड में भी कभी swelling होते हैं. So in this situation, if you are as a doctor, if you are certain and a little confident that it is thyroid related, I think a sonography, a routine sonography जो कहीं भी हो सकती है, can detect that there is some sort of abnormal nodule or sort of a gash in the thyroid gland. उसके बाद we can just do a sort of a सुई का जांच or an FNEC, fine needle aspiration, and you can diagnose the thyroid, what type of cancer, and how progressive this cancer is. So most of the things एक simple sonography से ही पता चल जाता है, and you can go ahead with the surgery.
नहीं, मैं बोल रहा हूँ treatment हो गया उसके बाद,
हाँ,
उसके बाद आप बुलाते हैं.
हाँ, तो एक बार ट्रीटमेंट हो गया, you can definitely surgery is the treatment, and then after that you might need radioactive iodine treatment. और ये ट्रीटमेंट के बाद हम लोग इन्हें फॉलो अप बेस्ड ऑन, जैसे हिस्टोलॉजी होती है, उनका फाइनल रिपोर्ट जो होता है, बेस्ड ऑन दैट हम लोग फॉलो अप करते हैं. सम इंडिविजुअल्स वी कैन फॉलो अप अराउंड 3 months, 6 months ऐसे इंटरवल्स में, बेस्ड ऑन हाउ likely they are to have to get that disease back. Now there are also simple blood tests which we do. अगर तो पूरा thyroid gland निकाला गया है तो we do something called as a TG or a thyroglobulin, जिससे it's a simple blood test, can be done anywhere. This can also sort of monitor the patient's progress of being without the disease.
जैसे एक last question probably because we are over time. ब्रेस्ट कैंसर में हमेशा कहते हैं कि लेट साइड इफेक्ट्स होते हैं दवाइयों की वजह से, ट्रीटमेंट की वजह से, जो भी है. इस तरह के कुछ लेट साइड इफेक्ट्स डॉक्टर निशा आपने ब्रेस्ट कैंसर, इसमें ओरल कैंसर में भी देखे? इवन डॉक्टर सिंह कैन आंसर आफ्टर डॉक्टर निशा.
मैम, लेट साइड इफेक्ट्स तो जो हमारे रिहैबिलिटेशन के रिलेटेड जो साइड इफेक्ट्स रहते हैं वो ज्यादा रहता है, जो सर्जरी, बिकॉज मेन जो ट्रीटमेंट है हेड एंड नेक कैंसर का, प्राइमरी ट्रीटमेंट इज विद सर्जरी. So after surgery जो reconstruction करते हैं, मतलब हम दूसरे part of the body से लेके skin, muscle, कभी कभी bone, ये सारे बहुत deep discussion होगा अगर ये start करेंगे, तो reconstruction होता है. तो उसके बाद में रहता है एक component which is called rehabilitation. Rehabilitation means उनका speech, पहले तो हमारा aim रहता है cancer हटाना, दूसरा aim रहता है कि वो खाना खा पाए at least, और उनको अच्छा cover रहे, ठीक है, ऐसे मुंह खुला नहीं रहे, वो खाना खा पाए और वो बात कर पाए. तो ये जो सारे हमारे ट्रीटमेंट रिलेटेड साइड इफेक्ट्स रहते हैं, वो ये 2-3 चीजों के अराउंड ही घूमते रहते हैं. और सबसे जो वर्स्ट लेट आउटकम, लेट साइड इफेक्ट जो है हेड एंड नेक कैंसर में, वो रिकरेंस होता है. बिकॉज रिकरेंस हमारे हेड एंड नेक कैंसर में होता है. दूसरा होता है सेकेंड प्राइमरी, मतलब एक कैंसर एक समझो मुंह में है, दूसरा कैंसर गले में आ सकता है. Even in the lungs it can come. So these are the things, that is why we need to keep the patient on follow-up, which is very important. And follow-up has to be very vigilant. It cannot be कि हाँ कभी आए कभी नहीं आए. It also depends on educating the patient कि तुम surgery के बाद उनको कैसे educate करते हो. Ma'am, and one thing on thyroid cancer again I wanted to add is there is something called familial thyroid cancer. So we have to give attention to even that aspect, because there are some cancers in the thyroid, like medullary thyroid cancer, which is more common in the family. So we need to be able to counsel the patients कि ऐसे cancers होते हैं, तुम्हारे जो relatives है उसमें भी हमें थोड़े testing करने हैं, वो टेस्टिंग करके हम फाइंड आउट कर सकते हैं, और उनमें कैंसर डेवलप होने से पहले उनका थायराइड सर्जरी करके प्रिवेंट कर सकते हैं. So this is one point I wanted to add, that there are some surgeries for thyroid which are done to prevent cancer, which is in familial cases. That's all.
Dr. Singh, would you like to give a message for our people, patients, caregivers, non-patients?
Definitely, madam. I think it is time to definitely stand up against oral cancer and the rest of the head and neck cancers which are preventable. And prevention starts from your home, and it doesn't, you don't need any big organizations or governments to help out in this. It is a simple form of education that you can educate yourself, and there are a lot of people helping out in this, right from your tobacco warnings to cinemas to school syllabus, and there are many things that are happening. But at the end of the day, I think if you want to do something, you can definitely do it. And most of these cancers which are preventable, I think you can take a step forward by yourself. So definitely be part of the treatment from the start, and I'm pretty sure you will not end up with this sort of disease, both which kills you both physically, mentally, and financially.
Thank you. Dr. Nisha, आप तो बिल्कुल बेल्ट में हैं टोबैको की वाराणसी में. पेशेंट्स तो हैं ही, साथ में उनके केयर गिवर्स. तो आपका क्या मैसेज है सबके लिए?
मैम, ये कि जब तुम्हें कैंसर लगे, पहला डाउट आए कि तुम्हें कैंसर है, सबको पता चल जाता है कैंसर है, उनको मुंह में, उनका मुंह खुलता है नहीं खुलता है, उनको पता चल जाता है कि कुछ तो खराबी है अंदर. जिस दिन ये खराबी महसूस हो उस दिन आके दिखाना है, नहीं जब कि वो बाहर आ जाए. जब वो बाहर लिटरली मैम, जब स्किन के बाहर आता है, जब बाकी लोग देखने लगते हैं, तब लोग आके दिखाने आते हैं. जब भी वो शायद इनऑपरेबल भी होता है, ऑपरेशन होता है, तो उसका रिहैबिलिटेशन, रिकंस्ट्रक्शन सब बहुत डिफिकल्ट होता है. तो जितना जल्दी तुम आओगे कैंसर के ट्रीटमेंट का, सिर्फ तुम्हें डाउट है तुम आ जाओ. हम कभी किसी कोई पेशेंट जिसको डाउट है, हम उसको ऐसे धिक्कारते नहीं है. हम उन्हें हमेशा एनकरेज करते हैं कि ऐसे अभी तो नहीं है, अगर कुछ ऐसा आए तो फिर से आ जाओ. So these early detection and cure is the actual aim that we should have so that even if some patient is detected with cancer, but it is an early stage, it is curable.
Thank you very much, Dr. Singh, and thank you very much, Dr. Nisha. On behalf of WeCare and also on behalf of public at large, our patients and our caregivers, it has been extremely nice to know so much about things and know that our doctors are in hand with us in this walk through oral cancers and head and neck particularly. I know that how caring all of you are and how much effort you have to put in to make sure that the patient comes back. And I must confess here कि जब हमने ऑर्गेनाइजेशन शुरू करी थी आज से 28 साल पहले, तब कई बार मैं भी ये बात कहती थी कि तुमने ये क्यों किया और तुम्हारी वजह से अब हम मतलब क्यों तुम एक्सपेक्ट करते हो कि तुमने एक गलत हैबिट फॉर्म कर ली और उसकी वजह से अब तुम्हें कोई हेल्प करे या तुम्हारे परिवार को कितनी तकलीफ हो रही है. Over the years, I realized it was a wrong statement that I was making because it was not going to help somebody. In fact, making feel very guilty, and so I changed my stand about it. पर शुरू में तो बिल्कुल मन में आता था तुम्हारी गलती के लिए कोई और तुम्हारे को क्यों पैसा दे, लेकिन मतलब ये 28 साल पहले की बात है. तो लेकिन आप जब इतने सालों से काम कर रहे हैं और देख रहे हैं तो उनकी भी समस्या समझ में आती है और उनकी क्या मजबूरी हो सकती है. Because normally what happens is that you become judgmental. You see the person and you begin to give an opinion on that. You don't know the reasons behind it. It could be anything जिसकी वजह से उनको ये आदत पड़ गई है. So instead of being judge and being harsh, I think what we really need to do is understand and then try to help out. And like you said, 50 आदमी, मैं तो कहती हूँ एक आदमी 5 को कह दे और उन 5 को कह दे 5 को और.
मैम 50 बोलेंगे तो शायद 10 को तो बोलेगा. दैट इज द एम एक्चुअली, बिकॉज अगर तुम इतना से बोल दो ना मैम, डॉक्टर के मुंह से अगर वो लोग ये सुनते हैं, they're going to think over it and at least जो उनसे मिलने आए उनको वो बोल तो देंगे, ऐसा होप रख सकते.
हाँ, पर डॉक्टर निशा आपके वाराणसी के हॉस्पिटल में जो भी आते हैं ना उनकी प्लीज पॉकेट चेक करवाइए, क्योंकि अभी ज्योति गई हुई थी वाराणसी and she found everyone had multiple pouches of tobacco in their pocket and they were hiding it all over and all that. तो शायद यूपी में अभी भी इस बात की बिल्कुल अवेयरनेस नहीं पहुंच पाई है या वो समझ नहीं रहे हैं. So I'm again not judging them, but I think that is the reason that there is so much tobacco-related cancer in that area.
Because here the tobacco chewer, the numbers are more. The pan and tobacco chewer numbers are more than the non-chewers.
Yeah.
That we should be accepting. That यहाँ पे ज़्यादा लोग हैं जो मुंह में पान रख के बात करेंगे ना कि बिना पान के बात. तो वो हमें समझना पड़ेगा that this is there. We cannot deny it.
गाना है ना, खा के पान बना रहे वाला, तो मुझे लगता है कि वो तो खाना है. अब गाना चेंज करना पड़ेगा शायद, तो बताना पड़ेगा अमिताभ बच्चन जी को कि आप गलत गाना गाते हैं जिससे कि लोगों को पान की आदत पड़ती है. But thanks again, thanks a lot, and thank you, Dr.
Thank you.
I'm sorry to keep out of your appointments, your surgeries, and everything for being a part of us. Thanks a lot.
It was great being part of it.
Thank you, madam.
Thank you.